Good afternoon, everybody. My name is Robin Simpson. I'm an NHS GP, and I'm one of the RCGP Veterans Champions, and I'm responsible for the RCGP Veterans Friendly Programme. And we're here to tell you about a recent evaluation we've had of our programme and really reinforcing the message that being accredited as a veterans-friendly practice really makes a difference. So joining me today, I've got Kate. Could you introduce yourself, please, Kate?
Yeah, afternoon, everyone. My name's Kate Salem. I work as a researcher at the University of Chester's Westminster Centre for Research and Veterans, and I conducted the evaluation of the veteran-friendly GP practice accreditation programme.
Kate, thanks very much, and we're looking forward to hearing about the evaluation. And Alan?
Hello, everyone. I'm Professor Alan Finnegan. I'm a veteran myself. I'm currently working at the University of Chester, where I'm director of the Westminster Centre for Research in Veterans, and I've worked with Kate on this project. And it was your other department that carried out the evaluation. So thank you very much to Kate and Alan for joining me. I realise that we're addressing practices that are already being accredited, but I'd just like to set the scene a little bit and remind everyone why veterans need that special help. So in the United Kingdom, there are about 2.4 million veterans, about the same number of diabetics. The majority of veterans are over the age of 75, but some of them are younger. And in addition to that, about 18,000 people leave the military each year. And when you've left the military, very much you're looked after by the National Health Service, you're looked after by an NHS GP, and you're looked after by NHS hospitals. And there's no doubt that veterans actually have specific health needs, largely to do with mental health. Clearly, having served in Afghanistan and Iraq, it's pretty likely that you're more likely to have a mental health problem when you do leave the military. In addition, you're more likely to have long-term injuries. So all those things make veterans a special group. And under the covenant, the UK government's covenant, we need to make sure that veterans are not disadvantaged. And therefore, we need to make sure that we know who our veterans are in the practice, and we need to make sure that their needs are being met. There still remains stigma around mental health, and male veterans in particular are not very good at seeking help until they really need it. And therefore, you as a GP or the GP practice really need to make sure that you know who your veterans are and ask that question, have you ever served in the military? The RCGP Veterans Friendly Programme has now accredited almost 1,300 practices across England, and it's been running for 3 years. And as part of that programme, we engaged with Chester University to carry out a review of our programme, to tell us how the programme was going, and to come away with key messages to practices that are accredited as why this evaluation shows us that accreditation really makes a difference. So this is about our evaluation, and it was Kate that carried out the evaluation. So first of all, Kate, why was there a need to evaluate this programme?
Evaluation research involves gathering and analysing information in order to provide feedback on an initiative or a programme, ultimately to gauge its impact and understand and improve its effectiveness. So organisations can help establish a programme's success or progress by periodically assessing that impact or effectiveness, and that was the role we played at the University of Chester. So we conducted an independent evaluation of this programme, and within that evaluation, we assessed 3 main areas. So what we were interested in was the impact that the programme was having on the veteran, the practice itself, and also the way in which the programme was being delivered and implemented.
Thanks very much. So those were the 3 areas that you're particularly looking at. And it would be really interesting to hear how you actually carried out the evaluation, please.
So we used mixed methods for this research project. For the quantitative element, we designed a survey with questions aligned to the aims and objectives of the research project. We included open-ended questions as well to further explore the benefits and challenges associated with the programme. We also collected demographic information from GP practices, from the veterans leads, and we also explored the impact that COVID-19 was having upon the delivery of the programme itself. So within that survey, we also included a request for primary healthcare staff to take part in a short interview with ourselves. Now, these interviews formed the qualitative element of the research project. And the aim of these interviews wasn't just to build on the results that we were seeing in the survey element, but it was also to further explore the positive outcomes, outstanding challenges, and also to assess whether or not the programme had made a difference to veteran help-seeking behaviour. So the evaluation began in May 2021, at which time 949 practices were accredited. Now, some of these practices were multiple location practices, so the number of practices recorded by the RCGP as having gained accreditation was 925. So those 925 practices formed our inclusion criteria, and therefore all were contacted. So we sent a survey link to all 925 accredited practices. So overall, we received 225 survey responses. Now, this is a 24% response rate. Now, given the significant pressures that GPs were facing or are facing during the COVID-19 pandemic, this should be considered a really exceptional response rate. We also conducted 15 qualitative interviews with veterans leads, and these were conducted on a first come, first served basis.
Really quite a big programme, and it was impressive that you managed to get such a good return despite the difficulties of COVID. You know, as an NHS GP, it's been really difficult during COVID just to survive, let alone take extra work. So well done you, Kate. And were you quite pleased with the way that the actual survey and evaluation took place?
Yeah, definitely. You know, we're really appreciative of all the veterans leads, all the GP practices who came forward, not just to complete the survey, but also who took time out, like you've just said, during really busy times to be interviewed by us. You know, we were conducting interviews at all hours of the day up until, 9 p.m. at night. So we do really appreciate it.
So you were quite satisfied that the evaluation really was reasonably extensive, and therefore the messages that came out of your survey really were relevant to the veterans accredited practices?
Yes, definitely.
Great. So Kate, what did you actually find? What were the results of your survey for those three different areas?
So we'll start off with the impact of the programme on the veteran. So we identified three main areas of impact on the veteran. So the first area is understanding of veterans' needs, and this was almost seen as like a domino effect. So 77% of our survey respondents said that they felt more aware of veterans' needs as a result of the accreditation. Then 84% said that they felt they were more understanding of veterans' experiences directly as a result of accreditation. This then had an impact on how much GPs really appreciated the need for veteran-specific care. This then subsequently resulted in more referrals to veteran-specific care and obviously more engagement with secondary services. So overall, what we also heard from veterans leads during the qualitative interviews was that this increase in awareness, increase in knowledge, increase in understanding really then had a positive impact on the doctor-patient relationship. We see more positive communication between both, which wasn't seen prior to the accreditation.
That's really excellent. So not only were practices being accredited, but the actual care of the veteran seemed to be much improved as a result of knowing more about veterans and asking those questions. Have you ever served in the military? So
within, again, that area of impact on the veteran, so we've done one. So the second area was understanding of veteran-specific services. So like I've just touched on, there was more referrals, more engagement with veteran-specific services, but actually a really important finding within this area of the evaluation was that GPs didn't think that veterans themselves were fully aware of the veteran-specific services that were available to them. So essentially what we were seeing was GPs bridging that gap between primary care and veteran-specific services. So we were seeing veterans utilising veteran-specific services that wouldn't normally have been utilised without that GP's knowledge. And I just want to highlight one quote here that really stuck out for me during the evaluation, that really highlights how important GP knowledge is and the difference that we've seen pre and post accreditation. So one veteran lead said to me, I didn't know about things that they could access, particularly with mental health and orthopaedics. Now I know where I can refer that veteran. And that really stuck in my mind because I think that's a really, really important quote.
As a GP, you come across a patient with a problem and you've got to think where to refer them, and then you discover they're a veteran, and actually being able to remember actually there are specific services for veterans will be really helpful.
Yeah.
So by being part of the program, you'll have that information, which you may not have had before the program. Yes. So any other area highlights, Kate?
Yeah, so our third area was in relation to help seeking and engagement. So obviously one of the aims of the programme itself was to improve veteran engagement with primary healthcare. So we did see a definite increase in help seeking from the accredited practices. It was only a small increase, but given the impact that COVID-19 was having on reduced opportunity to communicate, reduced footfall through the door, reduced time to implement the findings, this should be viewed as a really positive outcome of the accreditation. What we did see within the help seeking theme was that help seeking was more prevalent, and an increase in help seeking was more prevalent in the younger veterans. And actually 3% of our survey respondents said that they believed veterans over 80 wouldn't engage with an accredited practice based on the accreditation. And actually we spoke to 2 interviewees who were already engaging with older veterans prior to the accreditation. And although they said they didn't see an increase in engagement or help seeking in those older veterans, what they did see was that veterans were more appreciative. Those older veterans appreciated that the GP understood their experiences and understood their needs.
Yeah, I really get that. So the first of all, the younger veterans were being catered for, and the older veterans didn't really see a need for the GP to know that they were a veteran. They were most impressed. And I find that with our patients, you know, just that simple question, have you ever served in the military? And what did you do during the war? They really warm because they want to talk about those things. And it's just about giving them the opportunity to talk. And they come away with a smile on their face because they've been listened to. So,
and they were exactly the stories that we heard during the evaluation.
So would you be able to sort of give the highlights, just the headlines, just to finish this section?
Yeah, so there was a big improvement in GP knowledge and understanding and awareness of veterans' needs, which obviously really benefited the needs of the veteran. Veterans can be better treated and better identified by the knowledge that GP practices have through their accreditation.
So we've really got really good evidence there that the program is really making a difference to practices, it's making a difference to veterans, and we really are attempting to try and make sure that veterans aren't being disadvantaged, and we're meeting the requirements of the covenant. So that's excellent. Were there everything you've said is very positive. Were there any difficulties that you had other than COVID in carrying out your survey?
Yeah, what we heard from accredited practices was difficulties associated with promoting the accreditation process and also identifying veterans already registered but not correctly coded. Having said that, we did see improvements in veteran registrations and improvements to the coding system of veterans within primary care, but they were the main concerns that were raised by veterans leads.
Yes, because I think we're quite good at picking up veterans when they join practices, in that initial registration. But if they're already registered with a practice, unless we actively look for them, we're not going to pick it up.
And what we've seen actually in quite a lot of the qualitative interviews was veterans leads telling us that new strategies had been implemented to identify veterans. So now GPs and nursing staff were asking during consultations, have you ever served? And reception staff were asking on that initial patient contact, have you ever served? And that was obviously having a big impact on the number of veterans being registered and correctly coded.
Okay, we've mainly spoken about veterans, and of course with every veteran there's a family. Most veterans are males, so there may be a wife. is there anything you picked up about veterans' families or their wives as a result of the survey?
Not in the survey element, but in the qualitative interviews, there were a couple of instances where GP practices did say that they were better able to meet the needs of veteran families as a result of the accreditation. And actually, in these instances, the families themselves had actually heard about the accreditation and came directly to the GP practice as a result of hearing about the accreditation, hoping that they would be better understood.
So although we concentrated on veterans, the families were there in the background and they felt better supported.
Yes,
well,
definitely.
That's excellent. Did you hear anything negative? I mean, everything you've said sounds really positive. Was there anything that you heard which was of slight concern or negative?
I think in terms of promoting the accreditation, I wouldn't say it was negative. It was just difficult for veterans leads. But definitely in relation to the programme itself, the programme was really well received by GP practices. So overall, 99% of survey respondents said that they would recommend the programme, 76% of whom said the accreditation process was either good or very good. So overall, I'd say there was a really positive response to the way in which the programme had both been implemented and how it was being delivered and how patients were seeing changes being made.
Kate, I think that's truly excellent, and I'd like to congratulate you on your work. I know how much work and time you put into it, late nights, and thank you very much for pulling it together. You know, during COVID, we all have had difficulties during COVID, and you managed to pull it off. So well done to you and your team. So thank you very much. Let's bring in Alan to talk about, you know, why we need to evaluate programs and what the main messages for you that come out of this report, Alan.
Well, the need to evaluate the programs is it gives you independence. People who are immersed in these programs can feel that things are going well, but an independent overview can really look deep into what the issues are and hopefully provide some of those areas for development that you referenced, Robin. The differences this program has made, the findings from this report provides evidence to the accredited practices of what they're doing right, the areas for development, and will hopefully motivate other non-accredited practices to follow suit. The report provides GPs and primary healthcare staff with clear indicators of how veterans engage with primary healthcare, whilst highlighting evidence of how frontline staff connect and communicate with their armed forces community. There's also evidence, as Kate referenced, of better coding of veteran status onto their medical records. And all these factors combine to indicate improvements that will lead to quicker and more appropriate signposting to the best treatment options. This provides a solid foundation that can be built upon to further develop this worthy veteran-friendly initiative. These findings have significant implications for future policy development, for research, for educational programs, and importantly, clinical delivery, and the combination of which will help ensure veterans and their families receive the optimum care and support that they deserve.
That's great. So you must be quite proud of Kate's work and, you know, coming away with really important messages that, you know, actually, if we can educate and train GPs and their teams in looking after veterans through the RCGP Veterans Friendly Programme, that the care of veterans will really be better. And that's meeting the needs of the Covenant as well as providing better healthcare. So I think this is a really important piece of work. We don't know where the programme is going, but having this independent evaluation gives us evidence that actually you as a practice being accredited as veterans friendly really are doing something that's going to make a difference. So thank you very much for your evaluation, Alan and Kate for your hard work. And thank you very much to all the practices who are accredited. And what this program shows, that by being accredited, you can really make a difference. And encourage everyone else to ask that question, have you ever served in the military? And by asking that question, you're making the first steps to identify your veterans and therefore meeting their health needs. So Alan and Kate, thanks very much. For our audience, thank you very much for listening. If you want any more information about the program, it's available on the RCGP website. Just type in Veterans Friendly Practices, RCGP, and all the information were there. You are already an accredited practice, but if you're meeting any
one else from another practice, please spread the word, because we definitely need to accredit more practices. Thanks again to Alan and Kate, and thank you very much for your time.